Good morning, Dr. Dady, Center for Health and Healing. Today, I wanted to just give you a little bit of education on two things about the spine. I say two because we're going to talk about slow postural changes that are degenerative versus trauma and injury and how the body reacts, how the spine reacts to that. So let's get a little bit of education and even how you develop curves and how your spine should react. Your thoracic curves are already in place when you're born because they attach to the ribs, and that's called a primary curve, and it's the mid-back. The cervical and lumbar curves, the neck and lower back, are developed when you start crawling. When a baby's crawling and they lift up their head, they start developing that cervical curve, the neck. And when their belly drops down and they're crawling, it starts developing the lower lumbar, the lower back. And a little side note here too, to parents and grandparents that want to brag to their friends that their child is walking at an early age while they're kind of holding their hands in a little bit of forcing it, or in their little bouncy chairs. They will increase the percentage that the child might get scoliosis. So be careful with that. Let the baby start doing that on their own. So let's talk about slow degeneration. It's due to poor posture. Poor posture will change the structure itself, causing joints not to flex or move naturally and putting excess stress on discs and the vertebra. The spine then starts to decay. And this is especially serious because you don't feel pain or any obvious symptoms. They might not even be present until it's way advanced, the degenerative part of this. It reduces range of motion, scar tissue, and nervous system irritation, and it can impair your health and function of these tissues and organs. So just think about that for a minute. Here we have the brain, which is the computer. And then all these little nerves exit each, say you're in an elevator, so you're getting off at floor 1. This floor 1 goes somewhere, floor 2 goes somewhere, floor 3 goes somewhere to an organ or gland or a system and every cell in the body. So now if we start losing these curves due to poor posture, because the muscles will adapt to that. If your head's down a lot, these muscles will get tighter in the front and overstretched in the back. And now all that weight is going to be placed on the lowest disc. That's why people always have, when they have cervical issues, it's always usually like C5, C6. And then it starts interfering with the nerve, where the nerve goes. So you decrease function to the nerve, you increase disease and illness to the place that it goes to. Okay, so that's the slow degenerative part of it. Now we talk about trauma or injury. Abnormal bone growth is common response to uncorrected trauma or injury. The spine treats an injury and restricted motion of that injury and soft tissue damage. It's like a malfunctioning joint. So it starts laying bone down and it's kind of trying to splint it because it's trying to protect you. So its response to that lays calcium down the adjacent joint surface. It attempts to splint it together. And over enough time, when those start fusing, they're irreversible. It's kind of like it is a natural fusing. So these vertebrae will start fusing to the ones below. You'll see little bone spurs when you take film. And now you're not going to have the ability to flex and extend like you should. So every time you're trying to move your neck, it gets more calcified, more degeneration. So the prognosis of that, because that damaged subluxation, bone out of place, gets worse with time. Early detection and correction is really essential. Sometimes I can't talk. If detected for children, and you're very likely to be able to reverse it, because you can avoid deformity and damage on children if you catch them really early. I know many of you children, they fall a lot and they're learning how to crawl and walk. And so those are little minute, you can call them injuries. So being adjusted as a child will keep them from having issues as an adult. But when you reach adulthood, then you can improve and correct the joint function, hopefully slow it down or stop the degeneration. In my practice, I like to use this thing called a posture pump, because I know if you can restore the curve, you'll stop the progression and decay of degeneration. Therefore, depending on the level of damage or degeneration, you can restore the nerve function. Now, let me just say that a little less technical here. So if I have a straight curve and everything's loading, all that stress on this disc, and I put you on this posture pump, it'll start pumping into these segments and getting the ligaments and muscles back to where, muscle has memory. So it's going to retrain them to actually go back and have that nice curve for you again. Now what are we doing? We're opening up the nerves to function. We are pumping those discs up and getting the dehydration out of them. Why would you think that? So we'll take, for instance, your mom or grandmother. You're like, man, I think they used to be 5'7", now like 5'5". You start getting degenerative disc disease as you get older because the compression. I like to do decompression with patients so I can pump that disc up. So we'll say, why is it so important to have good posture? It keeps the bones and joints in the correct alignment so that muscles are being properly used. It helps decrease the abnormal wearing of joint surfaces, prevents fatigue because muscles are being used more efficiently. It allows the body to use less energy. And when you start losing the curves from bad posture, you will increase the pressure on the nerve and increase disease and illness. The best corrections for this, of course, is effective forms of specific spinal adjustments. These help return the spinal bones to their normal position, and the motion will start in that joint, start moving and giving that fluid back to the disc. And repeated adjustments will help retrain and support the muscles and ligaments. So with better joint and biomechanics of the whole spine, the normal healing process can take place. Because people always have that question, well, when I start having care, do I have to come forever? Well, when you brush your teeth, do you have to do it forever? Well, yes, because you use your spine every day. So wouldn't you want to give yourself that advantage as you get older to make sure that your joints function properly so your nerves can send signals properly without interference, without decreasing the function of that nerve to then increase disease and illness? Life's hard enough, right? So that's enough for today. I hope that this helped you understand more about how important it is to make sure your spine is aligned and finding the right practitioner that really does their job. They actually do decompression, muscle work, and very specific adjustments according to the x-rays and the health of the patient. Wonderful to talk to you today. I hope this has helped. If you have any questions, you can contact me at drdady@drdady.com, and my website is drdady.com. Have a wonderful day. Take care.